Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show. Welcome to MS&Me Interviews. I am your host, Erica Lyons Richardson. This week we are going to focus on new and exciting MS research that will be highlighted at ACTRIMS 2019. Founded in 1995, the America's Committee for Treatment and Research in Multiple Sclerosis, or ACTRIMS for short, is a community of leaders from the United States and Canada who are dedicated to the treatment and research in multiple sclerosis and other demyelinating diseases. ACTRIMS focuses on knowledge dissemination, education, and collaboration among the disciplines. Now, ACTRIMS also provides a forum where experienced and newer clinicians and researchers can exchange information, debate current issues, and discuss advances related to the basic research and clinical issues. ACTRIMS Forum brings together more than 1,000 researchers and clinicians annually to share these developments in the rapidly changing field of MS. The 2019 Forum will be held February 28th through March the 2nd, 2019 in Dallas, Texas. That will be a great location. Themed The Precision Medicine Approaches for MS, Scientific Principles to Clinical Application, this CME accredited meeting stands apart from many traditional medical meetings. They offer a single track of scientific and clinical presentations in an interactive environment. More information about the ACTRIMS 2019 Forum and the Kenneth P. Johnson Memorial Lecture that opens the event appears on the event's website, forum.actrims.org. Once again, that's forum.actrims.org. You can also follow the event on social media at hashtag ACTRIMS, ACTRIMS. That's hashtag ACTRIMS. It is so exciting and interesting to follow that hashtag during the forum. You'll see people who are on the ground at the forum like MS&Me was this past year, and we post under that hashtag all the latest presentations and the research we're hearing, and you'll see links to interviews, the latest research publications that will be coming out. It's amazing and very interesting, so I do recommend doing that during the forum. So once again, those dates are for the forum, February 28th through March the 2nd, 2019, if you want to follow along. Now, that opening lecture, the late Kenneth P. Johnson, MD, from the University of Maryland, led the effort to found ACTRIMS in 1995. The memorial lecture honors Johnson by providing an opportunity for ACTRIMS audiences to hear from prestigious clinicians or researchers selected for their knowledge, accomplishments, and contributions related to multiple sclerosis. MS is characterized by distinct disabilities including walking, cognition, and vision. MS patients differ markedly from each other regarding which disability affects them initially and most severely. Dr. Rhonda Vascule, professor at the University of California, Los Angeles, will present her hypothesis that molecular mechanisms underlying each disability may differ from each other based on regional differences in neurons, astrocytes, and oligodendrocytes. as the subject of the keynote Kenneth P. Johnson Memorial Lecture on the opening day of the America's Committee for Treatment and Research in Multiple Sclerosis, the Forum 2019. Dr. Vascule's team of researchers at UCLA determined that gene expression in various regions within the central nervous system, CNS, in MS preclinical model, the experimental autoimmune encephalomyelitis. So further, since the whole tissue gene expression reflects alterations in cellular composition during the disease, ribotag technology was used to determine that the transcriptome of the specific cells within each CNS region to provide insights into molecular mechanisms. Thus, the gene expression was determined in a cell-specific and region-specific manner during the disease. So regional differences in gene expression in the astrocytes during the disease were found. The work is proof of principle that the cell-specific and region-specific transcriptomics approach can reveal new therapeutic targets in distinct neuroanatomic regions during the multifocal neurodegenerative process. So the ultimate goal is to develop disability-specific neuroprotective treatments optimized to repair each disability one at a time. So in practice, such treatments would be tailored for each MS patient based on their predominant disability, with additional disability-specific treatments added in combination over time as needed, of course. So it is very exciting to see that her research is zeroing in on disability-specific treatments that once developed would be tailored for each MS patient. So as we've learned, MS and all autoimmune diseases are caused by a family of over 200 gene mutations. The gene mutations responsible for MS must be triggered by an environmental factor. So even though you're carrying these gene mutations, it's got to be triggered by this environmental trigger. All right. So environmental risk factors for MS include Epstein-Barr virus, cigarette smoke, and high salt intake. And there's many more that actually have been identified, but those are some of the main ones being targeted right now. It's so exciting to read that Dr. Vascule's team of researchers at UCLA determined that gene expression in various regions within the central nervous system in the MS preclinical model, experimental autoimmune encephalomyelitis. So further, that gene expression was determined in the cell-specific and region-specific manners during the disease. It's an exciting time in MS research and treatment. I'm sure you'll agree. So MS&Me Media was honored to be pressed for the ACTRIMS 2018 Forum in San Diego, California. You can find our interviews from the conference on YouTube channel, and for more information, you can visit our website, msandmemedia.com. That's msandmemedia.com. So let me switch now to what I think will be the response of many MS patients when they hear about this new research. Because one of the first things they might respond is something we've heard before when new treatments have been developed, and that is, oh great, another treatment. Why are they creating yet another medicine for me to take, infusion for me to take, pill for me to take, shot for me to inject? Why do I have to take more and more medicine? Can't they just fix this? What about diet? Can I just do diet and, more natural approaches to fix this instead of taking more medicine? That's a natural, response to hearing this research. So, we've been hearing this for years. There's been so many books that have been sold, lecture fees collected on, how an MS diet and some type or other has stopped someone's MS activity. The problem has been recreating this result in other patients without the chemo, HSCT, or intensive PTOT that the authors of these books have also received. So there have been great trials recently, though, like the one with the National MS Society in cooperation with Dr. Terry Walls. What they were able to show with that study was that her diet, the Walls diet, lowered fatigue. So although it did not impact the participants' MS progression, it did help lower their fatigue levels. So this year at the ECTRIMS conference, that's the European version of this ACTRIMS conference and forum that we attended in February and is coming up again in 2019 in Texas. This year they presented several more abstracts on diet studies. So we've all heard about the benefits of the Mediterranean diet. It emphasizes plant-based foods like fruit and vegetables. So in this presentation, Dr. Elanya Katz-Sand and colleagues at Mount Sinai Hospital in New York randomly assigned 36 women to this diet or to educational seminars. Those on the diet received training with a nutritionist and had to attend monthly meetings to promote their adherence. Only one person dropped out of this 6-month study. The participants reported that they were able to stick with the diet. Preliminary studies show that some improvement in fatigue and their quality of life. Of course, we need larger studies to see whether MS symptoms can be managed using the Mediterranean diet. But this small study shows how feasible these studies can be, according to adherence, which was the greatest question surrounding diet studies. Now, the ketogenic diets are high-fat, low-carbohydrate diets that have been shown to actually battle inflammation, similar to what happens during a course of MS. Dr. J. Nicholas Britton and colleagues from Virginia and Canada enrolled 20 participants with relapsing remitting MS. A trained dietitian taught them how to adhere to modified ketogenic diet. Now, their adherence was monitored daily by testing ketone levels in their urine. So fatigue, depression, and body mass index, which is an indirect measure of body fat, all improved after 3 months of dieting. So once again, it controlled fatigue, depression, and of course the amount of body fat. So that's very successful there. The inflammatory molecules that are secreted by fatty tissue were also reduced. Studies like these are what we need to eventually develop evidence-based dietary lifestyles that may benefit people with MS. There are many ways to go about studying diets, although it doesn't have the same statistical power as a controlled trial. So evaluating questionnaires results can allow researchers to involve more people, because as you can see, these dietary studies are usually quite small. Dr. Catherine Fitzgerald and colleagues at Johns Hopkins University in Baltimore analyzed data from a group of 277 people who answered more than 100 diet questions and were assessed for neurologic function. Their findings were that the participants with the best scores in diet quality had significantly higher processing speeds, faster walking speeds, than those with lowest diet quality scores. So I pose this very diet question to the president, president-elect, and programs chair of ACTRIMS 2018 in San Diego when MS&Me media were press at this forum. They all agreed that a heart-healthy diet, low in salt and sugar, was the best diet for someone with MS. In other words, we need to maintain our overall health and lower some of those inflammatory triggers like salt and sugar to diminish our MS symptoms. Will this stop disease progression or put MS into remission, as has previously been reported? That has not been shown. They have not been able to show that. However, throwing anything we can at it when you're living with MS sounds like a good plan. So I have listened to them and plan on incorporating their suggestion for lowering the symptoms while also listening to my doctor for my recommended treatment plan with DMTs, other medications to control symptoms, what have you. Of course, I also incorporate fitness into that puzzle, and that keeps up your function. So that will help increase function and maintain function when you're also incorporating the fitness angle. Now, me personally, this is a personal opinion, I also believe that helps rebuild the fitness aspect of it, also helps rebuild pathways, or at least build around, let's say, pathways that have been damaged, and bypass the damage and even return a little function, much like people are experiencing through the use of Acrevus as their DMT. They sometimes get a little return of function, some patients. I believe exercise also helps in that process, and that will actually help you get even more function return and maintain whatever you get back. So that's just my personal plan. So, many people ask me after they recommended the heart healthy diet and low in salt and sugar. When I ask them this question, they're like, well, why is diet so important in MS besides just lowering, say, fatigue and all that? Higher body mass index is associated with greater brain gray matter loss in MS. MS patients who have a higher BMI, body mass index, are more likely to have reduced brain gray matter volume. That's what's right under your white matter. When they do the MRI, the traditional MRIs, you will see your lesions in your white matter. Unfortunately, for like PPMS patients like me, a lot of our lesions are deeper in the gray matter, and it takes a more powerful MRI to even see a lot of the damage that both RRMS and PPMS patients have. So sometimes we have deeper, more debilitating disability because of these lesions in our gray matter. So the reduction in this brain gray matter is relevant since the gray matter volume loss it actually equates to the greater long-term disability. Exactly what I was just trying to explain, but that said it in a better way. Took me a minute to get my brain wrapped around exactly what I was trying to say. So, in a platform presentation, Dr. Ellen Mallory, she's an associate professor of neurology at Johns Hopkins University Precision Medicine Center of Excellence for MS in Baltimore. She, in her platform presentation, she did a companion part of the study that looked at whether the loss of brain gray matter correlated with levels of vitamin D, but they didn't find any significant association, because I know that's been a huge topic of conversation. Everybody's still trying to find that, connection with the vitamin D and what exactly it impacts with MS. So Dr. Mallory and colleagues reviewed the data from EPIC, a 5-year-long study that began in 2004 at the University of California, San Francisco, UCSF. The researchers enrolled adult patients, mostly from the UCSF MS Center, and with MS and or clinically isolated syndrome with expanded disability scores, EDSS scores, of less than 8. So the patients provided a blood sample and had a clinical evaluation and a brain magnetic resonance imaging scan, MRI, performed annually. The brain volume measures were determined using structural image evaluation. So basically, they're measuring that brain atrophy we all hear about that is looked at our neurological exams, but not often talked about. So when your doctor's looking at your MRI, he's not only looking for those, active lesions or inactivity, he's also looking for brain atrophy for that progression of the disease. The study included patients who had relapsing remitting MS or the clinically isolated syndrome with at least one follow-up visit. Now, BMI was calculated from self-reported height, weight, and was measured at baseline and subsequently self-reported after that. So, commenting on the study, Dr. Maria Piamato, Associate Professor of Neurology at the University of Florence, Italy, and the newly elected Vice President of ECTRIMS, told Neurology Today in a news conference that the change in brain gray matter volume associated with increasing BMI could be related to the adipose tissue causing increasing inflammation in the body. But really, it's all speculation at this point. We do not know the true mechanism of action, adding that smoking and vitamin D, among other factors, are hypothesized to affect MS. We do know that higher BMI in adolescent girls is associated with an increased risk of developing MS. So we can see from the last two topics that from our previous episodes that diet, fitness, salt intake, avoiding cigarette smoke, and vitamin D levels all play a role along with the gene mutations responsible for MS. So it's all part of the puzzle. As I stated, it's a very exciting time and hopeful time for us living with MS. The scientists are identifying the genetic process and the environmental factors involved in MS. They're also learning ways to slow the disease progression, turn off processes, and reverse damage. There are remyelination therapies in the studies that have been reported at ECTRIMS and will be coming out soon. The trials are becoming more inclusive of progressive patients and patients with higher EDSS scores. As I stated, that last study had them with a score up to 8, which normally they end at 6.5. That means patients who are more progressed, if you're not familiar with the EDSS scale. So patients, are anxiously awaiting all the new treatments that are proposed and talked about in the studies and will be featured in this keynote address at ACTRIMS 2019. As you can see, it is even more important than ever that we become our own advocate. If you cannot do the research any longer and advocate for yourself at your appointments, please take a close friend or family member with you to each appointment and have them advocate for you. So they need to advocate for you. Remember what the doctor said. Remember your questions and make sure that they are all expressed at the appointment. Sometimes for those of us who can advocate for ourselves still, it's important to still take that member with us, that family member or close friend who is with us a lot, can see us in daily life. And I've had cases when I was expressing to my doctor like new symptoms, what's going on with me, and I had forgotten some things, or I didn't even notice some things that were happening to me or that I was doing. And my care advocate who was with me said, "Oh, doctor, by the way, she is also, doing this, that, and the third." And that helped the doctor to determine my next course of care. So that can be very vitally important for you. It also is important when you have new medications or treatments suggested to you by your doctor, or a change in treatment, that you research it on your own. But just know, if you go no further than, say, the manufacturer's warning pamphlet, on the pamphlet you will see the FDA required warnings. Now, a lot of people don't know that those warnings are not necessarily things that are directly related to that medication or treatment. By law, when they're going through the approval process, anything that is experienced by those patients in the trial over the many years of trial, some of them are 4 years or more, that they experience, have to be listed as warnings. And sometimes it looks like they're directly related to that medication or treatment on the pamphlet as warnings. Say they might get a cancer warning. So many patients experienced a certain type of cancer, or PML cases. But then if you read the follow-up literature and research that comes out, because they continue the trials even after approval, they'll continue different research on those medications in the follow-up. It will actually state that turned out that none of the cases of PML were related directly to that treatment. It was the treatment they were on before they started this medication and did not have a long enough washout period, and it turned out to be related directly to that in further testing. Or things like cancer, and it turns out that follow-up research, it was just an anomaly, and follow-up research shows that the cancer rates in the population of patients that were on this new treatment were actually equal to cancer rates in the general population of healthy people who aren't on these medications. So you really do have to do your own research. Mayo Clinic is wonderful for that research, and so is the National Institutes of Health, their site. So if you Google something and you see information on it from the National Institutes of Health, that's very accurate. MS Trust is another great support. The MS Federation is a great source of information. So I really want you guys to do your own research. Much like in the MS&Me forums on Facebook, we will not allow misinformation. We get rid of any links that can't be verified. We really have to make sure that all that misinformation, rumor, and conjecture stays out of these forums, so the MS patients have the best chance of getting this information and making decisions for themselves. And we advocate anyone's choice, whether that's natural, a combination of natural and the medicines, or you just go straight DMT. Whatever your choice is, we're going to support you because you're part of the MS family. So join me again next week here on MS&Me Interviews, and visit our website at msandmemedia.com. Thank you.